Hi everyone, welcome to our channel. I'm Dr. Chabi Mehra, and today we will talk about gestational diabetes and all that you want to know about it. Gestational diabetes is glucose intolerance that happens during pregnancy. When a woman gets pregnant and the fetus develops in her body, the placenta that surrounds the fetus secretes hormones like estrogen, human placental lactogen, and cortisols. These are very, very important for the development of the fetus. But these hormones cause a contra-insulin effect, which means they do not let insulin get utilized by the body of the patient. And as a result of it, the pancreas senses hyperglycemia and tries to make more and more insulin. At a certain point, there's a tipping point at which the pancreas gets fatigued of making excess insulin for this insulin resistance of pregnancy, and the sugar levels start to rise in the body. And that is when gestational diabetes is diagnosed. Gestational diabetes is diagnosed by a test called the oral glucose tolerance test. In this test, you are given about 75 grams of glucose to consume, and your sugar levels are checked at 1 hour and 2 hours. At 1 hour, your sugar level should not cross 180, and at 2 hours, it should not cross 153 milligrams per DL. When your sugar levels are higher than that, you get diagnosed having gestational diabetes. There are many risk factors for developing gestational diabetes. The most common is being overweight. A BMI of more than 25 predisposes you to gestational diabetes. Comorbidities like hypertension, hyperlipidemia, cardiac diseases, PCOS, and certain ethnicities like Asian ethnicity or African American ethnicity predisposes you to have a risk factor for developing gestational diabetes. Gestational diabetes usually does not present with diabetes kind of symptoms, which are more thirst, more urination, fatigue, numbness, tingling, blurred vision. That isn't tied to diabetes. In gestational diabetes, usually it is a 24-week pregnancy sugar test, which actually checks an oral glucose tolerance test, and an abnormal test diagnoses gestational diabetes. Saying that, if sugar levels are extremely high in pregnancy, you will feel the fatigue, you will have more frequency of urination and thirst, but they're not the classical symptoms of gestational diabetes. Complications of gestational diabetes can be divided into two, one for the fetus, one for the mother. For the fetus, the children are born heavyweight and their head circumference is large, called macrosomia. So very difficult birth and trauma can happen during birth. Children can be born with cardiac defects. Children born to mothers with gestational diabetes can have severe hypoglycemia at birth. For the mothers, if they would have hypertension along with gestational diabetes, they are at a very high risk of preeclampsia, aneclampsia, and women after gestational diabetes, after delivery, tend to have a higher chance of developing type 2 diabetes if they had gestational diabetes. Gestational diabetes can be prevented. Keep your BMI down below 25. Control your other risk factors, like if you have blood pressure, it should be normal range. The cholesterol levels should be normal range. Talk to your gynecologist about PCOS and controlling your weight and your hormone levels. That will help you prevent. Treatment, on the other hand, if you have gestational diabetes, is basically insulin. That is the only way most doctors like to treat gestational diabetes if you are diagnosed with it and the levels are out of control. If your levels are just above the range, metformin is the only oral agent that is recommended for gestational diabetes. In the end, take care of your risk factors, like keep your weight down. Make sure your comorbidities like blood pressure, high cholesterol, PCOS are under control. Discuss your risk factors with your obstetrician and make sure you get early diagnosis and management. Next time, we will discuss management of type 2 diabetes, oral medicines versus insulin. Until then, have a wonderful day.